Hi everyone, I'm Jimmy. Today we're going to talk about something truly important. Simple first aid techniques inspired by traditional Chinese medicine that may help support someone during a stroke emergency. Let's start with why this matters. Stroke has become more and more common worldwide, and men are slightly more at risk than women. A stroke, sometimes called a brain attack, happens when the blood supply to part of the brain is blocked or interrupted. This can deeply affect someone's quality of life. The earlier you get help, the better chance someone has for recovery. That's why recognizing the warning signs and knowing simple steps may make a difference. So, what are the key warning signs of stroke? In TCM, we talk about 5 main clues. 1. Dizziness or confusion. That's feeling lightheaded, blurred vision, or not making sense. 2. Paralysis. The person might suddenly lose movement on one side of the body. 3. Facial drooping. You might notice a crooked mouth or one eyelid drooping. 4. Slurred or unclear speech. Words come out jumbled or hard to understand. 5. Numbness, especially tingling or numbness in the fingers. If you see someone suddenly fall, not answer when you call, can't move part of their face, slurs their words, or can't move one side of their body, it may be a stroke. Always, your first step should be to call emergency services right away. But while waiting for help, are there ways to support the person? Here are 3 traditional Chinese techniques you can use as first aid. Let's dive in. First, Shixuan point bleeding. In TCM, the Shixuan points are located at the very tips of the 10 fingers. The idea is gentle stimulation at these points may help alert the body and support consciousness. Here's how you can try it. So, start by gently massaging from the center of the palm towards the fingertips to get the blood flowing. If you have a clean lancet or a sewing needle, disinfect the fingertip. If possible, use about 75% alcohol. Lightly prick the tip of each finger, just enough to encourage 1 or 2 drops of blood, not more. Never press deeply or repeatedly. Wipe away each drop with sterile material as you go. The theory is that this may help relieve internal pressure, but remember, never delay professional medical care. This technique isn't a substitute for emergency treatment. Second, earlobe pricking. Earlobe stimulation is another traditional Chinese medicine emergency method. Gently massage the ear to increase blood flow. Then, using a clean needle or lancet, and after cleaning the skin, lightly prick the lower part of the earlobe. Just 2 millimeters deep is enough. Gently squeeze to get a couple of drops of blood and wipe away. In serious situations, you can do this on both earlobes at the same time. Again, always use clean tools and avoid pricking too deeply. Third, pressing the philtrum. The philtrum is that groove right between your upper lip and nose. In TCM, it's called renzong, or the G-Fi 26 point. Use your strong thumb, or even your fingernail, to press firmly on this spot in quick, short bursts. The area is sensitive, so press with enough strength, but avoid causing injury. Stimulation here is believed in TCM to help revive consciousness. Usually the first or second technique is enough. If needed, you can add the third method for extra support. Quick safety notes. Only prick each finger or earlobe once or twice. Do not overdo it. Never insert the needle too deep. Remember, always call the emergency number first. These methods are for support only while you wait for help. I truly hope you never need to use these techniques, but it's empowering to know simple steps that may help in a critical moment. That's all for today's share. I'm Jimmy. Take care, and I'll see you next time.